Hello, everyone. My name is Shawana Piggy, and I am a master's student in the Department of Biomedical Laboratory Sciences at the George Washington University. This course is MLS 6244, Research Ethics and Integrity. The professors in this course are Professor Harvey Vandenberg and Professor Tony Contento. The title of this case study is called Maternal Fetal Surgery for Spina Bifida, an Ethical Perspective. The case study presented is Maternal Fetal Surgery and the Profoundest Questions in Ethics. This case study is from the book Complex Ethics Consultations, Cases That Haunt Us, from the section starting from the beginning, Prenatal and Neonatal Issues. The editors of this book are Paul J. Ford and Dennis M. Dzinski. The author of this case study is Michael J. Blitton. The publisher of this text is Cambridge University Press. Rebecca is a young mother whom, in the 18th week of her pregnancy, her fetus is confirmed to have spina bifida. Rebecca decides to bring her mother with her to the consultation meeting. The options presented to Rebecca are either termination of her pregnancy or to have the maternal fetal surgery to improve the outcome of her fetus after birth. During the consultation, the ethics consultant notifies Rebecca of the benefits and the risks to her and her fetus in having this type of surgery. Rebecca decides to move forward with the maternal fetal surgery and at 23 weeks undergoes this procedure. During the procedure, her fetus's heart rate begins to drop while being repositioned and the surgery is halted. The ethics consultant describes the risk of the fetal complications that can be fatal and the risk of this type of surgery for Rebecca, the mother. The ethics consultant then explains to Rebecca the benefits of this surgery, including correcting the alignments of her fetus's spine for a better outcome after birth. During this surgery, as shown to the image on the right, the fetus must be repositioned for its spine to face the mother's abdomen. An incision is then made along the mother's abdomen to assess the fetus's spine for realignment. This is risky because during this procedure, the fetus is exposed and the mother may also experience complications if something occurs during the surgery. One complication that might occur is the mother's heart rate or partial CO2 becoming unstable during the surgery, resulting in the fetal heart rate decreasing. After this procedure was halted due to the fetal heart rate dropping while being repositioned, the fetus's heart rate ceases later that day. The fetus died from this procedure, but it was not completely understood why. After, the ethics consultant describes how he went to visit Rebecca the next day and that she was grieving. He ponders on if the outcome would have been different had Rebecca chosen a different option of letting the pregnancy go to term without any intervention. After a few days, Rebecca was discharged from the hospital. The physicians and the nurses who were part of Rebecca's care team did not discuss the outcome of her procedure and continued caring for other patients. The ethics consultant presents the questions: how did this outcome personally affect the care providers, and how much responsibility is necessary for them? The research consultant also questions how he presents the ethical concerns for maternal fetal surgery for the mother and her fetus in his future consultations based on this case. The risk of fetal maternal surgery are observed in this case study due to Rebecca's fetus dying at 23 weeks. This brings up ethical issues for the ethics consultant because of his role in Rebecca's case. As he looks back at the case, he describes how it haunts him when consulting new pregnant mothers whose fetuses are also diagnosed with spina bifida at 18 weeks gestation. He describes his responsibility In consulting for these cases, due to the high risk and the complications involved in this type of surgery, although the benefits of this surgery decrease the fetus's need for multiple surgeries after birth. In conclusion, although there are benefits associated with fetal maternal surgery for spina bifida, the risks associated with this surgery are unpredictable. The ethics consultant has an important role because they have the ability to thoroughly communicate these risks. They also communicate alternative options to the mother and whoever else is present at the meeting. In this case, it can be inferred that Rebecca felt a responsibility to take action instead of doing nothing in bettering her fetus's outcome after birth. Knowing the risks are important in making the best decisions in these circumstances, but the outcome can present challenges with these type of decisions. This article is relevant because it is important to observe maternal fetal undesirable outcomes. This article not only demonstrates the ethics involved in the decision making for this procedure, but the ethics involved after this procedure has been performed. An interesting point made in this article was the doctors and nurses involved in this surgery are also a part of the ethics, even though they continue to care for other patients after this surgery with no other mention of this outcome. The ethics consultant asked the question, does this pertain as well to the involved ethics consultants as seen with the nurses and the physicians? There is more literature analyzing fetal maternal surgery for spina bifida. One research article found that fetal deaths were 11.5% with no maternal deaths. This literature also describes the learning curve that healthcare workers have as the methods for this surgery progress. In other literature, similar ethical options of navigating a pregnancy in which the fetus has spina bifida are also explored. The ethics of this study from the mother's perspective was wanting to help improve her fetus's outcome in any way she could, even if there were risks involved. From the ethic consultant's perspective, he analyzed this outcome in a way that challenges how he consults in his future cases. He also analyzes his personal opinions of the surgery being too risky, even though a mother may want to have this procedure. The ethics consultant had empathy when Rebecca's mother shows him the fetus's spine while being wrapped in the blanket. He describes it as haunting and how it has affected the way he consults his patients. The physicians and nurses not looking back at these cases for ethical purposes may cause a disconnect when working with new patients. It is also important for them to look back at this case to determine if a maternal complication occurred affecting the fetus and how to prevent this in the future. According to the research study describing maternal fetal surgery, it is also important to better understand how the fetal heart rate is associated with the mother's partial CO2 and heart rate. Unfortunately, the cause of the fetal heart rate ceasing, causing death, was not further explored in this case. This case study is valuable because it explores the ethics involved when complications of a beneficial procedure to the fetus result in fetal death. Here are a list of the references used for this presentation. Thank you for your time. Please let me know if you have any questions.